Yeah, since we are in Dubai, so we have to talk about, thank you Mr. Qatar that you got the 4 a.m. in Dubai, but we need to change the society in Dubai to accept that, because in Arabic society, a lady is functional as long as she gets babies, and after she finished having her babies, so it is okay to have pains and aches and be fat and sit at home and nobody give her that big attention. A lot of patients, they're telling me, I am in the menopause. I see a few Arabic patients who are coming for menopause symptoms because they said, is this not normal that I have all these problems? I lived enough, I have my 8 children and that's it. So what we really need to understand, and our society is becoming more elderly, unfunctional persons, right? Why we do functional medicine, why we do anti-aging, why we want to reverse anti-aging, not just because we want to look beautiful and good, it's nothing wrong with that, but I want to die healthy. I want to die not in the ICU and cost UAE billions of dirhams. Every second or third person in UAE is diabetes and hypertension and metabolic syndrome. So the problem what we are facing is there is attack against hormone treatment, there is acceptance of the menopause, that it is normal. The government has no activities for elder patients. There is no clubs, no, like in Germany where I went to school and studied, there is a club for seniors club. Like I go, when I am 70, I do my exercise, I meet another companion where they have the same complaint, and I have my core where I go for 3 weeks and do gymnastic and do exercise, whatever. So we need to address that menopause can be reversible. I don't need to sit at home when I am 50, when I finish. My job as a woman is not just having babies, right? I grow the baby, I need to teach them well. I need to help them growing well. I need them to be a better wives, a better, having better sex life, right? This is the job of a lady who finished her baby. So in education for elder women, encourage her to go to the doctor, talk about menopause, go in the gym. Why, if I am 50, I cannot go in the gym as an Arabic woman or Orientalic woman? So we need a lot to address the media. We need to address the Ministry of Education, Ministry of Health, to accept even what we call functional medicine, because we have to say we still not recognize, which is a shame. Right? Because I cannot like sit and tell the patient about telomere and about her sex life, about her hormones, supplement, and I cannot back up my work, right? And I have there 10,000 endocrinologists on conventional doctors who say, what are you talking about? If the TSH so and so, why you give hormones, for example? Hormones making cancer. Breast cancer hormone is the first reason for, the hormone is the first reason for making breast cancer. So we really need to change that, and I hope that 4 a.m. Dubai will be the leader in this, and with your organization in Abu Dhabi, we will be able to change a lot.
One other very important aspect that I think
this is great. We do see increasing of infertility cases. We do see increases of IVF centers in every corner, almost in Dubai, IVF centers. And they take the patient, with all my respect to all my colleagues, and start doing for them IVF, IUI, ICSI, failed 1, 2. I have patients coming to my clinic, failed 8 IVF. Do you have, as a lady, any idea how much is this to go through months and years injection trying to get pregnant, and the depression after that by failed IVF? In my practice, that's why I came to the 4 a.m. I said, I cannot, what I'm doing since years in my OBGY, I am infertility specialist also, there is a puzzle missing. There is something, why if this lady is not getting pregnant? Then I start the functional approach. I said, okay, let me look at the body from head to foot. really, from her hair until her foot. What is missing in her body? So, and I find out, I'm doing this since 3 years intensively, that every failed infertility patient, we check her hormones from A to Z, her neurotransmitter, amino acid, her toxin in the body, her thyroid, her gut, and we try to find what is the problem. Believe it or not, I have in my clinic, sorry, I'm not trying to make advertisement now, but we see cases that they got spontaneously pregnant, healthy pregnancy, healthy mother, after failed 7 and 8 IVF, after low AMH, with everybody give up on the patient. With what? Bioidentical hormone. Just try to reverse her age, to reverse her hormone, to balance her body. We cannot still prove that on studies because the numbers are a little bit low. But it doesn't matter. If I am, as a OBGYN doctor, I could make a patient happy and remove her depression by giving her natural babies, why not? So that means what we was doing as in our profession is not complete. Right? We was looking, okay, you want to get pregnant, ovaries, hormone of the ovaries, uterus. We don't look. And then the trend started, give her DHEA, give her arginine, give her cartinine, based on what? So we start seeing patients overdosed in DHEA, overdosed in testosterone, because it was a trend for a while. This has really to change, and the functional medicine give me the way how I can think, how I can approach the patient, how I can connect the dots and make lines to get to the actual person. And one patient, we are successful with one patient, she will get another 10 patients, and the 10 patient will get another 100 patients. And we hope that the media slowly, with awareness for the ladies, if you cannot get pregnant, look for the reason. Very simple. Not go and do another IVF, look for the reason why you are not getting. Nutrition, lifestyle, exercise, gym, food, it's all related to each other. And of course, the doctor has to be the best sample. I cannot promote anti-aging and I look overweight. I cannot do that. I cannot tell her change your lifestyle and I don't know how the gym looks like. So it is very important that you are the best sample for your patient. But I think with this lovely country, we are on the right track, and we are optimistic. I'm very optimistic.
I just wanted to make one comment about the insurance. Today, as I was driving down Sheikh Zayed Road, there was a big hoarding from AXA Insurance saying that they would give a 45% reduction on the car premium if you didn't have any claims.
Exactly.
And in some ways,
exactly.
This is a model which is so beautifully replicable
in health.
Just,
true.
Yeah. You know,
Right.
that's what we need, to just make it just normal. Who looks after themselves gets rewarded for it, not the other way around.
Very true.
You
have to educate the patient. It will be wrong if the patient come to your office with the idea, I will go out from doctor now with one pill and everything is going to be fine. You have to educate her from the first visit. You will tell her it's not going to be like that, right? And then, but definitely you don't let her, you go out now, we still need the test to do, the test need 1 month to come or 2 months, and after that we sit and give you treatment. This will be a wrong approach. The patient, this is politics. So how you want to deal with the patient and get her to understand and cooperate with your treatment. So you will give her from the first visit things that make her comfortable, that make some of the symptoms go away, but you will tell her that in every visit she comes, she will be having, according to her result, it will be adding this and that and this, and then you talk about her lifestyle, what we said. So education of the patient, and this is what your role in the media outside, writing about it, educate the people, make them aware of that. Then it will be not 1 year. A patient can feel immediately better than before.
Once a person is on bioidentical hormones, how long does it take to see the results?
This is a huge problem. Actually, what we're trying to explain to the patient, that the beauty on the first place has to come from inside. She can do 10,000 Botox injection and filler. I'm not against that, not at all. If she is happy to do that and she go and have fun and do, why not? I want her to be happy. But she has to know that this is alone is not enough. I teach my patients, you have to enjoy, when we give her hormone therapy, enjoy putting the hormone on your skin. Enjoy taking the progesterone in the night with the idea it is going to help me. And after afternoon, I can go to Dr. Maria and have my treatment done. Nothing wrong with that. The way how you teach the patient, what I do in my clinic, it's similar what Dr. Linda do. I ask the patient to come after 1 month from giving them the hormone. I really make it fun for them. I tell her, when you put the hormone, the estrogen on your skin, like you put the cream on or you make makeup. When you put makeup on your face, you don't look like this in the mirror, and you put things. You are happy, and you put your eyes, and you put the makeup. I want her to put the cream on her butt or on her arm with happiness, and take the progesterone in the night. Wow, I'm going to have the best sleep. With this attitude, the patient already started to feel better, and we do really see improvement after 1 month. I call them always after 1 month, and say how you feel, and I tell them I have a small question, just 1 page, so it's not boring for the patient, and I will see how much point was severe, and if these severe points became moderate, and the same points became mild, and then they will disappear, and then they know it will not be it is not like that. We are not making magic. It is not magic. It is together work, right? So, but still, cosmetic is a huge issue in Dubai. We try to make it combination. We are aesthetic people. We say God is beautiful and like beautiful things, right? So this is in Islam we say that. Allah Jamil yuhib al-jamal, صح? But this is nothing wrong with that. But the combination. Always balancing. This is the point of anti-aging.
Yes.
Balancing, make everything smoothly, nicely in the middle. From everything you take the things that you need and you put them together and you'll be happy.
Ma'am, question.
Spain,
First of
Italy,
all,
they are not able now to support elder people who are in retirement, and they paid their taxes for years. Remember, because the government are paying more for people who need attention in the ICUs, in the rehabilitation centers, elder sick people. This is the dilemma where we are, right? What do I want? Do I want a society that can work until 80 or 90 and still giving? Or I need society which is 50-60% of it elder sitting at home causing problem for the new generation. Remember how many sitting in the room has to take care of their mothers or aunties or fathers who are elder, and they have limited possibilities, and we get depressed and for hormone imbalance, and we cannot sleep, and we are our cortisol is down because we are not able to take care of these people, right? Can you imagine if my mother, your mother, everybody is healthy, how the society will look like, right? So,
and working,
right?
healthy and working. If she's healthy and still working, she'll be productive.
Exactly.
Yeah, of course.
Yeah, exactly. But it is. We don't talk about just anti-aging. We talk about anti-aging, regeneration, functional medicine. So it is like a complete picture. I want to reverse age, like my colleague said. So this is what I explain to the patient. I don't want. It is not just anti-aging because I don't want to get old. Of course I don't want to get old, but I want to make my body functional. I think for me this is the key word. And in the anti-aging medicine, they are like more than one field. I will go and take preventive medicine. I take a healthy person, study his gene. We spoke a lot about genes and telomere, for example, and try to teach him how to avoid him getting cancer or Alzheimer. Or I have a patient with complaint whose body is not functional optimum. Then I will talk with her about functional medicine, how to re-function her body. And then rejuvenation, like, okay, I'm 50, I have few wrinkles, I'm a little bit, maybe the skin sagging, I don't build muscle. Then I will talk to her about anti-aging, because I want like to reverse her age. So, so the issue is, of course, I think as a doctor, you really need to learn a little bit about psychiatrists, about psychology, sociology, my German language coming out now, sorry, yeah. So, yeah, because my main language is German, actually. So, in my opinion, a good doctor, I did a lot of courses like that. I did a course where we sit here, like here, and then we had professors in front of us, and they teach us a role model. So how I will speak to a patient, so that one of us was the doctor and the other was a patient, and I learned really in these courses, how can I tell the patient that she has cancer? How can I tell the patient that she is not doing well? How can I tell the patient that her baby is abnormal? You have to learn. A good doctor has to do that, right? And I think this is the key, because this is what makes a difference between doctor and doctor. How can I approach the patient? How I can make her things, which is, I tell my patient one thing always, take the problem in its volume. You have a problem like that, take it like that. I have a problem like that, I take it like that. But if I have a problem like this, I don't make it like this. So this is important. This is how you approach the patient. Maybe coming from, because we are used, when a patient comes for me, my patients are usually young, like 30 years, start even in the 20th. So they are young, mostly healthy. When some of the patients, they come and maybe she is 30 and she will tell me, I feel old because I am depressed, I cannot sleep, I feel tired. So they use these symptoms are related to feeling old. I have no sex drive, I cannot smell even my husband, I feel bad, depressed, whatever, right? So so when you tell her it's anti-aging, so I will remove all these aging things. But actually in the functional medicine, I don't want even an elder lady to feel like that. So we are reversing, actually. I agree with my colleague, actually, that, yeah, I agree with you, Dr. Linda, that this word anti-aging, I think it's coming from the people more, from the audience, more than from the doctors.
And maybe even from the media more.
Yeah.
You know, it's a sexy term.
Thank you. We will be concluding the Q&A panel. I'd like to thank all of you for being here. I'd like to thank our presenters, our CEO, our attendees for being here. And of course, I'd like to invite you to share that information with the patients, with the medical community, in the interest of the economy, the patients, and also the physicians' satisfaction. Thank you.
Thank you very much.